Assalamu alaikum. My name is Dr. Rabia Sidal from Anatomy Department, Sahara Medical College, and today the topic of discussion is muscles in the layers of sole of foot. For MBBS students in UHS-based examination system, a very important thing is to remember the organization of the sole of foot. That is layering and different structures present in the different layers of sole. Here we'll discuss one of the important things, that is the muscles arranged in the four layers of sole. The foot is the most important structure for the locomotor activities of human being. So it is so finely structured and each and every bit is organized in a way to enhance the locomotor activity of human being. And we have a special field called podiatry to deal with the study and care of feet. The organization and skeleton of the foot has been discussed in a separate lecture, but minor details can be observed in this diagram. The skin covering the dorsum of the foot is thin, and the subcutaneous tissue is also loose connective tissue. Not a lot of amount of fat present there, as we can observe here in this section. And this section and this part of the region is more vascular as compared to that. The sole of the foot has thick skin, especially in those areas which are in contact with the ground, and this is what is required also. So the skin is very thick over the heel, over the margins or borders of the feet, or the ball of big toe. Then the subcutaneous tissue in the sole also contains more amount of fat, and this fat is arranged and here in the diagram you can also observe more around the heel and also around the pressure points. This fat has a cushioning effect when the foot is in use during walking. This arrangement along with the arches is going to increase the efficiency of foot. Now these two diagrams show the deep fascia of foot in the dorsum here and here in the plantar aspect. The deep fascia of the dorsum is thin as compared to the deep fascia of the sole. Here you can observe that the central part of deep fascia here is very thickened, and it is known as this triangular band called plantar aponeurosis. Plantar aponeurosis is going to cover the major groups of muscles and the neurovascular structure, and it is going to protect these structures during walking. And then you can also observe the digital vessels and nerves and cutaneous structures emerging through the deep fascia. This plantar aponeurosis is also going to give septa going deep from it and dividing the layer of sole into compartments, as here we see in this diagram. This diagram is similar to the cross section of palm, but it is upside down, as we have already discussed in previous lecture about the embryological reason of this relation. But here you can observe that from plantar fascia, different septa are passing and attached to the metatarsal bones and dividing the sole of foot into medial compartment and then central compartment in green, medial compartment in blue, then the lateral compartment in orange. Then we have the interosseous compartment containing the interosseous muscles, deep layer, and in the dorsum we can observe the dorsal compartment. There are 20 intrinsic muscles of foot. Two of them are present in the dorsal compartment, that is, they are present in the dorsum of foot, while the rest are present in the different compartments of foot. Four in the deep compartment, intermediate position, while 14 in the plantar aspect. As we have seen, vertical septa from plantar aponeurosis divide the plantar muscles into compartments, and these muscles are arranged in four layers, which we will discuss ahead. These layers consist of the intrinsic muscles as well as the long tendons of the extrinsic muscles acting on foot and the neurovascular structures. The muscles are there to facilitate the efficiency of foot during movement and also maintain its arches. Individually, their action is not very pronounced, but these small muscles are going to enhance the efforts of long tendons, and also their action is important in specific situation like pushing the foot off the ground or fixing the foot on the ground for stability. So now discussing the layers individually. The first layer of sole contains three muscles: abductor hallucis, abductor digiti minimi, and flexor digitorum brevis. The lateralmost muscle of the first layer is abductor digiti minimi. Here you can observe it is arising from the medial and lateral tubercles of calcaneal tuberosity, and also the plantar surface in between these tubercles, and also from the adjacent part of plantar aponeurosis. The tendon is inserted here over the lateral side of the base of proximal phalanx of the fifth toe, and also a slip towards the head of fifth metatarsal. Nerve supply of this muscle is via lateral plantar nerve, and medial and lateral plantar arteries both supply this muscle. Action of this muscle is to plantar flex and abduct the fifth toe, and as the muscle's location is along the lateral border, it is going to support the lateral longitudinal arch. Now the second muscle of layer 1 is flexor digitorum brevis. Origin is from the medial tuberosity or elevation of the calcaneal tuberosity, and the adjacent part of plantar aponeurosis. As can be observed in the diagram, the tendon of the flexor digitorum brevis divides into four tendons, and these tendons are going to split up against the middle phalanx and then are attached to the middle phalanx of the lateral four toes. Here these two tendons are exposed to show the splitting, and in these two the tendons are wrapped by the flexor sheaths. Now flexor digitorum brevis is similar to the flexor digitorum superficialis in hand, which splits up and inserts on the middle phalanx, while the flexor digitorum longus on the back of the leg enters the tarsal tunnel and comes to lie deep to the flexor digitorum brevis, which we'll discuss in the next layer. Divides into four tendons also, and just like the flexor digitorum profundus in the upper limb, this tendon, or each tendon of flexor digitorum longus, is going to pass through the gap between the tendons of flexor digitorum brevis. Here you can see the tendon is coming out here and then inserted on the distal phalanx. So this is a similar arrangement as we have seen already in a hand in upper limb. And this muscle is a plantar flexor of the digits 2 to 5, and it also supports the longitudinal arches. It is supplied by medial plantar nerve, and also blood supplies through medial and lateral plantar arteries. Third is the abductor hallucis muscle, that is the abductor of big toe. The origin is from the medial tubercle of calcaneal tuberosity, and also some fibers arise from the adjacent part of flexor retinaculum and plantar aponeurosis. Insertion is here on the medial side of the base of proximal phalanx of first toe, and also on the medial sesamoid bone present in the tendon of flexor hallucis longus. Like flexor digitorum brevis, it is also supplied by medial plantar nerve. So in this layer, only abductor digiti minima is supplied by lateral plantar nerve, and abductor hallucis and flexor digitorum brevis is supplied by medial plantar nerve. As the insertion and direction of fibers show, this muscle abductor hallucis is plantar flexor at proximal interphalangeal joint of big toe, and also abductor of this digit. Now, talking about the arrangement in layer 2, we will observe that there are two intrinsic group of muscles, and there are two extrinsic or long tendons present in this layer. The intrinsic muscles are, here you can observe Quadratus plantae, or this is also known as flexor digitorum accessorius, and then we have these muscles called lumbricals. The long tendons are the tendons of flexor hallucis longus. Here you can observe this tendon, and then we have the tendons of flexor digitorum longus. An important thing to remember, and we'll discuss it later when we talk about the details of neurovascular structure, that the neurovascular structures are present in two layers or two planes. Some part is present in between the layer 1 and 2, and some part is present in between the layer 3 and 4. So the first plane is between layer 1 and 2, where medial plantar nerve courses between these two layers in the medial compartment, and the initial part of lateral plantar nerve and lateral plantar artery also are present in this superficial plane. The insertion of long tendons have already been discussed in the compartments of leg, especially the back of leg. So we're going to discuss here only the origin, insertion and action of intrinsic muscles. Now the first group consists of lumbricals. There are 4 lumbricals. We'll count it from the big toe. So the counting will be from medial to lateral side, 1, 2, 3 and 4. You can clearly observe that the lumbrical 1 is a unipinnate muscle, half feather, and the 2, 3 and 4 are bipinnate muscles. They are arising from the tendons of flexor digitorum longus. Here you can observe the first lumbrical is arising from the medial aspect of the tendon of flexor digitorum longus of second digit, and then the second, third and fourth lumbrical arise from the adjacent tendons of flexor digitorum longus of the adjacent digits. Like the lumbricals of upper limb, these lumbricals are also going to pass the plantar aspect of the metatarsophalangeal joint, and then they are going to bend towards the medial side of the phalanges and insert on the dorsum, on the dorsal digital expansion or the extensor expansion, which is similar to the lumbricals in the upper limb. Now the nerve supply is also a bit different. Only the first lumbrical is supplied by the medial plantar nerve, while the lumbrical number 2, 3 and 4 are supplied by the deep branch of lateral plantar nerve. Blood supply is through medial and lateral plantar arteries. Action of these muscles is also similar to upper limb. These muscles are going to plantar flex at metatarsophalangeal joint here, and then they are extensor of proximal and distal interphalangeal joint. So there is a paradoxical movement here. These muscles are important when walking and running. These keep the digits or toes extended and do not let the toes buckle under the sole. The second muscle of this layer is Quadratus plantae or Flexor digitorum accessorius. This muscle has two heads. Here you can observe a medial head which is arising from the medial surface of the calcaneum, and also part from a medial tubercle, and then the lateral head which is going to arise from the calcaneum in front of the lateral tubercle. The two heads unite here, you can see, making an acute angle. It is inserted on the lateral side of the tendon of flexor digitorum longus, as you can observe here. Nerve supply of this muscle is from lateral plantar nerve. Blood supply is through medial and lateral plantar vessels, and as per its attachment, this muscle is going to strengthen the pull of the tendons of flexor digitorum longus and helps in the flexion of toes. And the layer 3 consists of three muscles. Here you can observe flexor hallucis brevis, adductor hallucis, and flexor digiti minimi brevis. So the first muscle to discuss here is flexor digiti minimi brevis. The origin of this muscle is from the base of fifth metatarsal, here you can observe, and then also some fibers arise from the peroneal sheath of this peroneus longus tendon, which is passing towards the fourth layer, you can see here. This muscle is inserted on the lateral side of the base of proximal filling of this fifth toe. Nerve supplies through the superficial branch of lateral plantar nerve, and blood supplies through lateral plantar vessels. This muscle is a flexor at metatarsophalangeal joint of the fifth digit or fifth toe. Adductor hallucis muscle arises from two heads of origin. Here you can observe this is the oblique head, which arises from the bases of second, third, and fourth metatarsals. The transverse head is arising from the plantar metatarsal ligaments and deep transverse ligament of the metatarsophalangeal joints of the third, fourth, and fifth toe. This part has no bony origin. Two heads unite to insert on the lateral side of base of the proximal phalanx of first toe, in common with the insertion of the tendon of lateral head of flexor hallucis brevis, and some fibers are also inserted on the lateral sesamoid bone of flexor hallucis longus. This is a very important muscle. It not only simply adducts the first toe or the big toe, it is going to maintain the transverse arch, and this is the most active muscle when the foot is about to be pushed off the ground. This muscle is not only going to fix the transverse arch, it is going to pull the metatarsals towards the big toe and keep them fixed, prevent them from spreading during the push off or takeoff phase, which is an important action to be discussed in detail in a walking mechanism. The third muscle of the third layer is flexor hallucis brevis. It has two limbs. Here you can observe the lateral limb and the medial limb. The lateral limb and medial limb mostly are arising from the cuboid bone and also from the lateral cuneiform bone. But you can also observe here that the medial limb is also attached to the tibialis posterior tendon. This is the tibialis posterior tendon here coming out of the flexor tunnel. The medial and lateral limbs are going to insert on the medial and lateral sides of the base of proximal phalanx or first toe or big toe, respectively. And this muscle as a whole is supplied by medial plantar nerve, and it is a flexor of proximal phalanx of the first toe, which is at the metatarsophalangeal joint basically. Muscles of the fourth layer of sole present in the interosseous compartment of sole are the plantar and dorsal interossei. Other than that, there are two extrinsic tendons also present in this layer, which is the tendon of peroneus longus or fibrillaris longus coming from the lateral compartment, you can observe here, and then the tendon of tibialis posterior coming from the posterior compartment of leg here. The two intrinsic muscles will be discussed here, as the two extrinsic attachments have been discussed in their respective compartments. Now, in sole, all the books agree that there are three plantar interossei and four dorsal interossei. As again, we have already seen the deep head of the flexor hallucis brevis, which could be the fourth plantar interossei. Now, the three plantar interossei are unipinnate muscles. They are rising from the bases and medial sides of the third, fourth, and fifth metatarsal here. Their insertion is on the medial sides of the bases of proximal phalanges of the third, fourth, and fifth digit, and also on dorsal digital expansion. Nerve supply is through lateral plantar nerve, and blood supply is through lateral plantar vessels. These muscles, as we had memorized in upper limb, dab the pad, the PAD, plantar interossei are going to adduct the toes towards the middle toe, and they are also going to assist the lumbricals muscles in their action as they are inserted on the dorsal digital expansion. Now, as we can observe clearly, the dorsal interossei are all bipinnate muscles, so they are going to arise from the adjacent surfaces of all five metatarsals. You can see the first one here rising from the lateral side of first and medial side of second. Then we have the second dorsal interossei, third and fourth dorsal interossei. Only the first dorsal interossei is inserted on the medial side of the second toe, while the remainder of the three dorsal interossei are going to be inserted on the lateral sides of second, third, and fourth toes, and also on the dorsal digital expansion. The nerve supply is through lateral plantar nerve, and the blood supply is through lateral plantar vessels. These muscles, as we remember from the DAB, are abductors of the toes from second to fourth toe, and they are also going to help the lumbricals in flexing the metatarsophalangeal joints. Now, summarizing the four layers of sole, we have observed that in the layer 1 and layer 3, we have only three extrinsic muscles each, while in layer 2 and in layer 4, we have four muscles, out of which two are intrinsic and two are extrinsic. We have also discussed, and we will discuss in detail, the neurovascular structures are present in two planes. The superficial plane is between the layer 1 and 2, and the deep plane is between the layer 3 and 4. as they are present on the plantar side, these are adductors, abductors, and flexors, the small joints. This is flexion towards the plantar side, or simply called flexion in the small joint, and the opposite movement would be called extension. The only extensors present in this layer are the lumbricals and also the dorsal and plantar interossei, which are going to perform extension at phalanges due to their attachment to the extensor expansion. Then in the nerve supply, we observe that in the first layer, two muscles, abductor, hallucis, and flexor digitorum brevis, are supplied by the medial plantar nerve, while one muscle is supplied by the lateral plantar nerve, which is abductor digiti minimi. Then in layer 2, we can observe among the two intrinsic muscles, the quadratus plantae is supplied by the lateral plantar nerve. Among the lumbricals, only the first lumbrical is supplied by the medial plantar nerve. Rest of the three lumbricals are supplied by lateral plantar nerve. In the third layer, we can observe that only flexor hallucis brevis is supplied by the medial plantar nerve, and the adductor hallucis and flexor digiti minimi brevis both are supplied by the lateral plantar nerve. Then in the fourth layer, both the intrinsic groups are supplied by lateral plantar nerve. So we come to the end of the discussion of the muscles of the layers of soles. Thank you.